Heart Diagnostic Tools, EKG or ECG, Electrocardiogram. You can see here the P wave, the QRS wave, and the T wave. Remember, T wave is atrial depolarization. QRS, we're looking at ventricular depolarization, particularly with the ST segment specifically. And then the T wave is the ventricular repolarization. The atrial repolarization is hidden inside this QRS spike here. When we look at an EKG, we can use it to find myocardial infarction. Myocardial infarction will be indicative in the EKG. Also, pulmonary embolism, interestingly enough. This is showing representing ultrasound. And when we use ultrasound, an electrocardiogram, this instrument is specifically Doppler ultrasound, but if we use an electrocardiogram with Doppler ultrasound, we can look at cardiac volume. I thought this was an interesting image with all the different colors in here. So cardiac volume, which will then give us an idea of cardiac output. But we can also see structural defects, and you can see there's a structural defect here in the mitral valve because the blood should be flowing from the left ventricle into the aorta, and we see it's now backflowing. Here we have an image of an MRI. This is representing positron emission tomography. It's also representing computed tomography, which are very different, very different. Positron emission tomography has to do with emitting gamma rays, and you're looking at metabolic states. And then MRI, you're realigning electrons. And then computed tomography is using slice images. Here we see an atherosclerotic plaque. We see atherosclerosis. Remember, put the F in front of it, FAT, fat. So you have fat buildup in the artery, and they've done an angioplasty here. They put it in a balloon. With the MRI, with positron emission tomography together, you can find these. You can find these atherosclerotic plaques. It's being affected, but it's not available yet commercially. Although it may be in some areas. I mean, research is dependent on the time it was done, and there you go. It may by the time you're watching this. So, and here we see coronary anatomy, and you can see the anatomy of a vessel, and we could see that with computed tomography, CT scan, computed tomography. We're taking slice images. All right, let's take a look at the notes. So electrocardiogram, looking at a myocardial infarction, pulmonary embolism. Ultrasound, cardiac volume, structural defects. MRI and positron emission tomography, atherosclerosis, fat buildup in the artery. CT scan, computed tomography, coronary artery anatomy. Now let's try and do it without the notes. Can you do it without the notes? Here we go. Electrocardiogram, myocardial infarction, pulmonary embolism. And remember, this also, you could say EKG or ECG. We usually say EKG in emergency situations because if you say ECG, someone may hear EEG, and that's an electroencephalogram. And now you're looking at the brain, which you should be looking at the heart. Ultrasound, echocardiogram, cardiac volume, which will give us an idea of cardiac output, and structural defects. And again, this showing mitral valve prolapse. MRI, magnetic resonance imaging, with positron emission tomography, atherosclerotic plaques. Computed tomography, coronary artery anatomy. Thank you for joining me today.